to the International Nursery and Sustainable 2022. Azadi Ka Amrit Mahotsav, nation celebrating 75 years of independence, and World Environment Month 2022. Collaboration with resource faculties, Holistic Foundation India, and Sri Research Institute and Center for Art, Sciences and Health. Welcome you all once again. Before we start our session, let's take the blessings of our nation.
शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः
Blessings of Almighty Vishal session. Hey, today we are commemorating World Blood Donor Day. The theme, donating blood is an act of solidarity, join the effort and save lives. We all know that one-time donation can save up to 4 lives. So, at the blood requirement due to various reasons like accidents, diseases, illness have been growing since its inception, and more demand is coming up, and it's a need of the hour that to meet the requirements. Especially in COVID, we have seen there was dearth of blood supply because everyone was very cautious about precautions, safety measures, and there are other diseases which need continuous blood transfusion to be done. So in all these contexts, it is very much required that we need to support this blood donation, and it's very safe, and also it's very beneficial for the humankind. World Health Organization and United Nations and across the globe, we all are celebrating and commemorating World Blood Donor Day on 14th June each year. So this day was created to raise global awareness of the need for safe blood and blood products for transfusion, highlight the critical contribution voluntary unpaid blood donors make to national health systems, support national blood transfusion services, blood donor organizations, and other non-governmental organizations in strengthening and expanding their voluntary blood donor programs by reinforcing national and local campaigns. So this day also provides an opportunity to call to action governments and national health authorities to provide adequate resources to increase the collection of blood from voluntary unpaid blood donors and to manage access to the blood and transfusion of those who require it. Blood and blood products are essential resources for efficient management of women suffering from bleeding associated with pregnancy and childbirth. Children suffering from severe anemia due to malaria and malnutrition, patients with blood and bone marrow disorders, inherited disorders of hemoglobin and immunity deficiency conditions, victims of trauma, emergencies, disasters, and accidents, as well as patients undergoing advanced medical and studies. So the need for the blood is universal, but access to blood for all those who need it not. So blood shortages are particularly acute, low, and middle income, and ensure that everyone who needs transfusion has access to safe blood. All countries need voluntary, unpaid blood donors that help. An effective blood donor program characterized by wide and active participation of the population will meet the need of blood transfusion during peacetime as well as during emergencies or disasters. So when there is such demand for the blood or when the normal operation of blood services is affected, while an enabling social and cultural atmosphere with strong solidarity facilitates development of an effective blood donor program. It also widely acknowledged that the act of blood donation contributes to generating social ties and building a united community. So this year we the focus is having the theme or the slogan set as donating blood is an act of solidarity. Join the effort and save lives to draw the attention to the roles that voluntary blood donations play in saving lives and enhancing solidarity within communities. The specific objectives of this year campaign are to thank blood donors in the world and create wider public awareness of the need for regular unpaid blood donation, highlight the need for the committed year-round blood donation to maintain adequate supplies and achieve universal and timely access to the safe blood transfusion, recognize and promote the values of voluntary unpaid blood donation in enhancing community solidarity and social cohesion, and also raise awareness of the need for increased investment from governments to build a sustainable and resilient national blood system and increase collection from voluntary, non-remunerated blood donors. So, in this context, so countries, NGOs, individuals across the world are encouraged to implement for this year's campaign is to disseminate to various media outlets stories of people whose lives have been saved through blood donation as a way of motivating regular blood donors to continue giving blood and to motivate people in good health who have never given blood to begin doing so. So your involvement and support will help us to ensure greater impact of the World Blood Donor Day, increasing recognition worldwide that giving blood is a life-saving act of solidarity and that services providing safe blood and blood products are an essential element of every healthcare system. So with this context set, we take this opportunity to thank each and every blood donor on the planet for their invaluable selfless contribution that they have made in saving lives. And we also invite and encourage, motivate those who have been already donating their blood regularly and those who haven't yet donated blood. It's safe to donate blood every 3 months. So we invite you and encourage you to come forward and donate blood for the noble cause. Also, blood service can give patients across access to the safe blood and blood products sufficient quantities of key component of an effective and the global theme of the World Blood Donor Day of selfless donate their blood for the and noble cause donate blood and life. This context. So let's see what is blood and how it works. What are the various components in blood? What are the various groupings and the types and added factors? Basically, the physiology and anatomy of the blood. The blood is a combination of plasma and cells that circulate through the body, supplies essential substances such as sugars, oxygen, hormones to the cells and organs, and removes waste from cells. So health conditions that affect the blood can be life-threatening, but effective treatment is often available. So the main components in the blood are plasma, red blood cells, white blood cells, platelets. So plasma accounts for around 55% of blood fluid in humans. Plasma is 92% water and the contents of the remaining 8% include glucose, hormones, proteins, mineral salts, fats, and vitamins. The remaining 45% of the blood mainly consists of red and white blood cells and platelets. Each of these has a vital role to play in keeping the blood function effective. So let's look into each component of the blood. Red blood cells or erythrocytes. Red blood cells have a slightly indented, flattened disc shape. They transport oxygen to and from the lungs. Hemoglobin is a protein that contains iron and carries oxygen to its destination. The lifespan of a red blood cell is 4 months and the body replaces them regularly. The body produces around 2 million blood cells every second. The expected number of red blood cells in a single drop, that is microliter of blood, is 4.5 to 6.2 million in males and 4.0 to 5.2 million in females. The next component is white blood cells. White blood cells make up less than 1% of blood content, forming vital defenses against diseases and infection. The number of white blood cells in a microliter of blood usually ranges from 3,700 to 10,500. Higher or lower levels of white blood cells can indicate disease. And the next component is platelets or thrombocytes. Platelets interact with clotting proteins to prevent or stop bleeding. They should be between 1,50,000 to 4 lakhs platelets per microliter of blood. So bone marrow produces red blood cells, white blood cells and platelets. From there they enter the bloodstream. Plasma is mostly water that is absorbed from the ingested food and fluid by the intestines. The heart pumps them around the body as blood by the way of blood vessels. So let's look into various functions of blood. Blood has various functions that are central to survival. They include supplying oxygen to cells and tissues, providing essential nutrients to cells such as amino acids, fatty acids, and glucose. And not only that, removing waste materials such as carbon dioxide, urea, and lactic acid, and also protecting the body from diseases, infections, and foreign bodies through the action of white blood cells. White blood cells, though it's just 1% of the entire blood, but are very crucial in protecting the body from diseases, infections, and foreign bodies, and also regulating body temperature. The platelets in the blood enable the clotting or coagulation of blood. When bleeding occurs, the platelets group together to create a clot, and the clot forms a gap which stops the bleeding and helps the bone from infection. Let's see what are the various groups. The first blood type is determined by the antigens of the red blood. The antigens are protein molecules on the surface of these cells. Antibodies are plasma that alert the immune system present in the presence of potentially harmful foreign substances. The immune system protects the body from the threat of disease or infection. Knowing a person's blood type is essential if they are receiving an organ donation or blood transfusion, and antibodies will attack new blood cells if the blood type is wrong type. That's why it's very much necessary. And also it can lead to life-threatening complications. For example, antibodies will attack cells that have A antigens. So red blood cells sometimes contain another antigen called Rhd. So doctors also note that this as part of the blood group. A positive blood group means that Rhd is present, like Rhd positive or Rhd negative. Humans can have one of the 4 main blood groups. Each of these can be Rhd positive or negative, forming 8 main categories. These are major blood groups, and there are other minor blood groups as well. So these groups can be group A positive or A negative. So here A antigens are present on the surface of blood cells, and anti-B antibodies are present in the plasma. And group B positive or group B negative. Here B antigens are present on the surfaces of blood cells, and anti-A antibodies are present in the plasma. And next group is group AB positive or group AB negative. A and B antigens both are present on the surfaces of blood cells. So there are no antibodies in this plasma. Group O positive or group O negative. There are no antigens on the surfaces of blood cells. Both anti-B and anti-A antibodies are present in the plasma. So people with group O blood can donate to virtually any blood type. The people with AB positive blood can usually receive blood from any group. So these are universal. Group O are called universal donors, and group AB positive are called universal receivers or recipients. People can talk with their doctors or medical professionals or the uh, lab professionals, technicians to find out their blood type or find out by donating blood, because by in the process of donation they will also let you know the type of the grouping and the RH factor of your blood. And blood groups are important during pregnancy. If a pregnant person has RH negative blood, for example, but the fetus inherits RH negative positive blood, RH positive blood, treatment would be necessary to prevent a condition known as hemolytic disease of the newborn. So there might be a reaction because the antibodies fight with each other. So generally a treatment is required there. A small injection is being given in such cases. And let's quickly look into disorders. Disorders and diseases of the blood that can impair many functions that the blood performs. So some common blood disorders we will look into. The most common is anemia. This happens when low red blood cell or hemoglobin levels means the cells do not transport oxygen effectively, leading to fatigue, pale skin and other symptoms. And another common disorder is blood clotting. Clotting helps wounds and injuries, but blood clots that form inside a blood vessel can create a blockage, which can be life-threatening. So if clot becomes dislodged and moves through the heart to the lungs, the pulmonary embolism can form. So that's why there if blood is too thick or too thin, thinner or thicker set, generally administered on medical advice in case of surgery or as per the requirement. And blood cancer. Some blood cancers such as leukemia, myeloma, and coma occur when blood cells start to divide uncontrollably without dying off at the end of their life cycle. These are called blood cancer. Hemophilia. The person has low levels of clotting factor in blood. They can bruise or bleed very easily, and they may bleed for too long after a minor injury or surgery or during operation. And they will lose the entire blood and they will risk risk of dying. So it is very important that blood, blood gets clotted within the specified time. Sickle cell disease. This is an inherited trait causes red blood cells to on a crescent shape, and it can severely impact how blood functions and can be life-threatening. I will show you to be more effective. I will be showing some videos which can give audio visual component of the same after this presentation, so that you can also visualize and see what I am speaking about. So, and the next is thalassemia. This is also a type of inherited anemia in which the body produces an unusual form of hemoglobin. It affects around 1,000 people, and is most common in people from around the Mediterranean and the parts of Asia. So if symptoms suggest a person may have a blood disorder, they should immediately seek medical advice such as hematologist. So we have seen that blood is essential for maintaining the health and life of the human body. It has many functions including delivering nutrients and oxygen, and we have seen that four main components of the blood are red blood cells, white blood cells, plasma, and platelets. So problems that arise due to illness or blood loss can be life-threatening, but effective treatment is available for many blood-related disorders. And why this blood donation is important? Because blood cannot be manufactured and there is no alternative treatment for blood transfusion. It is therefore crucial for people to donate blood to save lives. And also, blood needs to be delivered to hospitals, clinics, and wherever required regularly and consistent, just like our daily supplies, essentials, and need to be delivered. And then we end up with empty shelves in our blood banks, just like neighborhood uh, uh, retailers or essentials or daily supply stores. And if the supply chain breaks down, and you know what will happen, but blood is constantly needed to save lives. There we can survive for 1 or 2 days, but here, if uh, we don't get blood in time, then that cannot be remediated. So it's very essential for all of us to donate blood, and that keeps us healthy. There are a lot of benefits of blood donation that also we will look into. Please. What are the challenges we have? Uh, like challenges are various for patients who are already very sick in the hospital or having life-saving surgeries like transplants. They are either transfused less than the normal dose of blood or they need to wait. This can be deadly for some of the sickest persons. So, due to non-availability or shortage of blood supply. And there are also certain blood types that are affected by the shortage in different ways. So when you receive blood, you must also be appropriately matched so that your body accepts that blood and not to have an adverse reaction. So this is also very important that we have seen earlier in my presentation that there are different groupings and RH types, and not every every group can be given to everyone unless it is an universal recipe. So how we can solve this problem so that everyone is encouraged and to donate regularly, voluntarily, and unpaid. Again, this paid form of donation is a different issue that creates a different kind of thing. But in unavoidable situations, it is necessary. And there are certain risks also associated that we will be discussing later. Now, let's see uh, what will happen. Uh, Generally, we are all nowadays talking about platelet count, right? And we have also seen the normal platelet count, and a person's platelet levels can change with age and certain medical conditions can also affect them. So a platelet count that is too low or too high can lead to health complications in low platelet count is known as thrombocytopenia, which is a high, while a high platelet count is known as thrombocytosis. So when we can call the platelet count is high, normal or low. The high platelet level, that is thrombocytosis, is when the platelet count is more than 4,50,000. And the normal platelet level, as already mentioned, it's 1,50,000 to 4,50,000 platelet count. And the low platelet level, that is thrombocytopenia, is less than 1,50,000. So, but again, as earlier said, it depends, and this should be taken account while considering other variables such as person's age and sex. And what does that mean when your platelet count is high or low? So when you have a high platelet count, that causes the bone marrow to make too many platelets than required. So when the reason is unknown, it is called primary or essential thrombocytosis. So when excess platelets are due to an infection or other condition, it is called secondary thrombocytosis. So what happens when there is excess platelet count or higher platelet count? A person's blood clots more quickly when we have too many platelets. So clotting is a natural protection against bleeding. The body produces more platelets during and following an injury. However, because platelets cause blood clotting, they can cause dangerous blood clots in arms or legs. The blood clot can or may break off or travel to another area of the body. So the risk of blood clot is higher in people confined to the bed by illness or who cannot move their limbs. So this is why exercise is very important. The mobility, even simple exercises like walking, running, jogging, not like that power training in gyms and all, but simple exercises like running, jogging, walking can help us preventing these conditions. And someone who has a high platelet count because of recent injury, but who must remain in bed, may need monitoring to reduce risk of blood clots as a result. Blood can get clot anywhere, even in brain, even in heart, and even in brain. So we have to be careful when the platelet count is high. And when the platelet count is low, then what? A low platelet count can make it difficult for the blood to clot, putting a person at risk of excessive bleeding. And this may be inherited tendency not to produce enough platelets, but the cause may be unknown or it may be due to underlying medical condition. So higher risk of spontaneous bleeding can occur if the blood platelet count falls below 20,000 per microliter. A person can begin bleeding spontaneously. This is a medical emergency, and people who experience spontaneous bleeding may require blood or platelet transfusion. It increases the blood demand. So low platelet count increases the risk of death in people who experience a traumatic injury. What are the causes for this excess high platelet count? Several factors can cause a person's platelet levels to change. So these can include acute and chronic medical conditions. Also, for high platelet platelet count. Some temporary conditions can cause a higher than normal platelet count. Doctor or a health professional can retest a few days or rapid steps are common. Are generally likely high platelet levels are found. Storing from a recent injury, storing from blood loss or after surgery, storing from excessive drink or vitamin B12 deficiency, physical activity or exercise such as running a marathon, in birth control pills. So these may likely increase high platelet count. If a person platelet count remains high, chronic medical conditions may be responsible, like cancer, anemia, inflammatory disorders, infections, splenectomy. In cancer patients, lung, stomach, breast, and ovarian cancers, as well as lymphoma, that is blood cancer, can cause high platelet counts. Additional blood testing, imaging scan, or biopsy can be tested for cancer. And people with anemia, that is iron deficiency or hemolytic anemia, may have high platelets. Further blood testing can detect most forms of anemia. Inflammatory disorders. Diseases that can cause an inflammatory immunity response, such as rheumatoid arthritis or inflammatory bowel disease, can increase platelet count. Person will have other symptoms, most cases, and infection. Some infections, such as tuberculosis, can cause high platelets. And splenectomy, that is removal of spleen, can cause a temporary increase in platelets. And what are the causes of low platelet count? So common causes of low platelet volume include or count include such as various factors like viruses, medication, cancer, anemia, infection, autoimmune disorders, chemotherapy, poisoning, cirrhosis, chronic bleeding, and others. So viruses such as mononucleosis, mononucleosis, HIV, AIDS, measles, and hepatitis may deplete platelets. And medication, when the person is under medication, drugs such as aspirin, H2 blockers, quinine, antibiotics containing sulfa, and some diuretics may lower platelet count. And in cancer patients, cancer has cancer that has spread to the bone marrow can harm the body ability to make new platelets. So lymphoma and leukemia are common culprits for low platelet count in cancer patients. So anemia, a type of anemia called aplastic anemia, reduces the number of all kinds of red cells, including platelets. And a bacterial infection, especially the blood infection called sepsis, can reduce platelet count. And autoimmune diseases such as lupus and Crohn's disease lowers platelet count by causing the body to attack its tissue. Chemotherapy harms existing tissue and cancer cells, making it difficult for the body to produce platelets. And exposure to some pesticides or poisonous gases or fluids can damage platelets. And liver cirrhosis, often due to excessive drinking, alcohol consumption, smoking, can reduce platelet count. Chronic bleeding, any disorder that causes ongoing uncontrolled bleeding, such as stomach ulcers, can deplete platelets. So platelets count can also or generally tends to decline with age. The platelet count that is lower than it was once was or lower end of the normal may not be cause for the concern in an older adult. If you have a higher count earlier and due to age, if you now have a lower count, that may not necessarily mean that there is some issue. But anyway, it is always advisable to get a professional advice, especially if there are no other symptoms. So, how do we check this platelet count? So, it is performed as part of CBC, complete platelet picture test, and it is also affordable. Generally, it varies somewhere amount. It depends. It is freely done in government institutions and even outside also, depending on the institution or lab. It is somewhere around 50 rupees to 1000 rupees. It depends on the lab and the kind of process they use. So we can summarize saying that changes in the platelet count may mean that a person has a chronic illness or an issue with the bone marrow. So it is generally not possible, however, to diagnose a medical condition based on a platelet count alone. So we should consult medical professionals for further testing if a blood test reveals low platelets. And it is also advisable to inform the doctor or medical professional about any other symptoms which can help narrow down testing options. And also medicines, poisonous substances, heavy alcohol drinking, and even drinks with quinine in them, such as tonic water, which can cause low platelet counts. Quinine is found in tablets for leg cramps. And the pesticides, arsenic, benzene, and antiplatelet or anti-clogging drugs, that is such as glycoprotein, LLB, LLB, LLA, AAA inhibitors, including abciclumab, eptibarate, and tirofiban, and heparin, and other over-the-counter medications, acetaminophen, ibuprofen, ibuprofen, naproxen, and other medications like amiodarone, ampicillin, or any other antibiotics, simedetine, piperacillin, and seizure medications such as carbamazepine and sulfonamides, and such as trimethoprim, sulfamethoxyline, and vancomycin, etc., can also decrease the platelet count. Now, we have seen the various blood disorders and like anemia. Anemia majorly involves disorder with red blood cells, and leukopenia, white blood cells, and thrombocytopenia involves platelets. So these can be broadly classified into various disorders based on the blood components and their functions. And categories of blood disorders that increase blood components. So generally in anemia, leukopenia and thrombocytopenia, here the blood components are decreased, and when there is blood disorders which occurs due to increase or which increases the blood components of erythrocytosis, leukocytosis, thrombocythemia or thrombocytosis. So here also similar way, red blood cells, white blood cells and platelets. And in white blood cell disorders, as already discussed, neutrophils, which destroy bacteria and viruses, and lymphocytes, which kill viruses and regulate the immune system, monocytes or macrophages, which eat dead or deactivated bacteria, viruses and fungus, and basophils and eosinophils, which help the body respond to allergic reactions and help destroy parasites. So these are the major functions that are and types of white blood cells help the body to fight infections. So these lies in the bone marrow and develop into different types of cells and systems, each having a different immune purpose. That's how white blood cells are very important. And some white blood cell disorders impact all different types of white blood cells in the blood, while other disorders only involve one or two specific types of the five types of blood cells. Neutrophils, lymphocytes get impacted the most here. The proliferative disorders involve a rapid increase in the number of white blood cells that are circulating the blood, mostly of people because of infection. Although occasionally bone marrow cancers may also be a So apart from this, there are various other blood cancers. Radiation surgery, targeted surgery, stem cell transplant, other white and reflected most common types as already discussed: iron deficiency anemia, pregnancy, vitamin deficiency, non-inherited inherited hemoptytic anemia, inherited hemoptytic anemia, aplastic anemia. These are common types where there are not enough blood cells or the cells do not work correctly. Among the most common blood disorders, especially with red blood cells. Iron deficiency anemia is caused when the body does not have enough iron or cannot properly absorb it. Pregnancy anemia, where there is more of a demand for red blood cells than normal and hard deficient. And vitamin D, vitamin deficiency anemia usually caused by low dietary intake of vitamin B12 and folate. So these folic acid tablets are given. Syrups and after two various forms. Non-inherited hemodialysis anemia, where the blood cells are broken and destroyed in the blood subnormal, either by injury, illness, or medication. And inherited hemolytic anemia, where red blood cells are broken down or destroyed more quickly than the body can replace them. And aplastic anemia, when the bone marrow stops producing enough red but most commonly blood transfusions, dietary changes, surgery, medications that stimulate production of bone marrow and new red blood cells. So, we have covered the white blood cells and the red blood cells and platelets. Yes, platelets we have already discussed. And especially common platelet disorders include hemophilia, that is a genetic condition caused by lack of or defective clotting factors in a person's blood. Generally, people with hemophilia bleed longer or more excessively, both externally and internally, even without any condition. So, hemophilia is often passed down from parents to their children. Vulnerability, but it is known as better known blood condition. And one will join this occurs when the body lacks the one will join factor, the substance that allows platelets to stick together and form clots. Most cases of clots will join are relatively mild and people may only require treatment. They are injured or undergoing surgery. While many blood disorders involve a reduction in number of platelets present in the blood or their function, several conditions cannot excess of platelets. So, what is the treatment? Treatment includes typically replacement therapy or transfusions containing specific clotting factor and additional therapies. And, therapies include desmopressin, a synthetic hormone that promotes the release of one filtrate factor and factor 8, and antifibrinolytic medication that prevents blood clots from breaking down, and birth control medication to reduce heavy menstrual cycle. And then there is heavy menstrual bleeding. And additional treatment as discussed, blood transfusions and corticosteroids to slow platelet destruction, and immunoglobulins to block the immune system, and surgery to remove the spleen in severe cases. So, what are the signs and symptoms of various blood disorders? You can see frequent infections, wounds that do not heal or slow to heal, unexplained exhaustion, unexplained weight loss. These are commonly seen when there are white blood cell disorders. And when there are red blood cell disorders, we have signs or symptoms like unexplained exhaustion, shortness of breath, dizziness or lightheadedness, rapid heartbeat, muscle weakness, difficulty concentrating and remembering, and paleness. These are few commonly seen symptoms when there are red blood cell disorders. And when there are platelet or clotting disorders, commonly seen signs of symptoms are difficulty forming blood clots like wounds or controlling injuries that are slow to heal or keep reopening, and unexplainable bruising or skin that easily bruising, and unexplainable bleeding from the nose, gums, gastrointestinal system, or urogenital system. So these can be signs and symptoms of platelet and clotting disorder. So, but many disorders can affect different components of the blood, including the white blood cells, red blood cells, and plasma. And as already discussed, symptoms may vary according to the type of blood disorder the person has, and most include general and unexplained weight. So again, treatments depend on the type and severity of the condition, but will often include chemotherapy or radiation therapy if required, as required. So these are the various disorders that can occur due to insufficient or overproduction of blood components. And as we see, red blood cells carry oxygen to the tissues and entire body parts. White blood cells fight infection, and platelets and smaller cells help blood to clot. So these three components are very important. And why we need to understand all this? Because we need to know the importance of blood and various disorders that can occur, and we can donate the whole blood or just the components of the blood. If there is only requirement for plasma or red blood cells or white blood cells or platelets, we can donate only any one of the components or the whole blood. So without without giving complete whole blood, we can donate the blood component. So, and also we need to understand what causes and what are the signs and symptoms that can be noticed and reported to health professionals so that these blood disorders can be prevented. And blood is conducted or supplied or transferred to blood vessels, arteries and veins, and blood is prevented from clotting in the blood vessels by the smoothness and finely tuned balance of clotting factor. And various blood tests available are complete blood count or complete blood picture, CBP, and blood smear, and blood typing, and Coombs test for checking antibodies, and blood culture, looking for infection present in the bloodstream, and mixing study, that is to check whether the blood is too thick or too thick, and bone marrow biopsy to check bone marrow, and also identify blood condition. And as already discussed, various treatments include in case of cancers, blood cancers or related cancers, chemotherapy, and blood transfusion, platelet transfusion, fresh frozen plasma, cryoprecipitate, anticoagulant, anticoagulation, that is thinner or thicker, thickening of blood, antiplatelet drugs, and antibiotics, erythropoietin, and blood testing. So depending on the condition, and based on individual components or whole blood disorders, these are the various treatment options that is best suggested by the health professional. Hello? Can you hear me? Can I mute yourself or use chat box? Just note the audio. Okay. So let's quickly watch two videos about what I presented till now, so that you can have the visualization of these things also. So let me share.
On World Blood Donor Day, we highlight the life-saving power of blood transfusions. Voluntary blood donors come from all walks of life, but they have one thing in common. They give of themselves to others, people they don't even know. Blood donations are a lifeline in emergencies, disasters, humanitarian crises, and for people who need regular transfusions. Throughout the COVID-19 pandemic, blood donors have continued to give. In so doing, they have provided an essential service to their communities and a safeguard for patients and health systems. And yet, around the world, many communities do not have access to safe blood. Women and children are the most at risk. So please, give blood if you can, and give regularly. And to the millions of blood donors around the world, thank you. You're literally lifesavers.
This is the story of one drop of blood. This drop of blood started out in the body of Parry. When her friend Mariam was in labour and started losing a lot of blood, Parry didn't hesitate and donated blood to save her friend's life. That drop of blood, with many others, went from Parry to her friend Mariam, and Parry saved Mariam's life. It's also the story of another drop of blood. Manuel sees every day how accidents happen all the time. He feels a connection to his community and wants to do his part to contribute to the well-being of his people. Every 3 months, he goes to the clinic and donates blood. Manuel's blood drops go to hundreds of people who need them to survive. This is the story of millions of drops from millions of people that decided to make an act of solidarity by donating blood. Everywhere in the world, blood from millions of people who donate blood to their community are saving lives every day, providing a precious safeguard for patients and communities. Blood donation is an act of solidarity. Join the effort. Save lives.
Sorry. Let's look at the general procedures which are adopted by the blood bank or hospital when we go there for blood donation.
Donor recruitment is the first essential step in the process of a blood transfusion service. It begins with the screening of prospective donors through the sharing of pre-donation information regarding transmission of transfusion transmissible infections that is provided in the IEC material and counseling. In the pre-donation counseling, the donor is asked questions regarding his or her lifestyle and behavior that may be categorized as high risk. This is an important step to reduce the risk of HIV window period transmission. Voluntary non-remunerated regular donors are considered to be ideal for safe blood supply. The minimum weight requirement for the collection of 350 ml of blood is 45 kilograms. For collecting 450 ml of blood, the donor's weight should be at least 50 kilograms. Their age should fall between 18 and 65 years. The hemoglobin count needs to be at least 12.5 grams per deciliter for the donor to be eligible. This can be checked using the copper sulfate method. While checking the hemoglobin count, the lancet should not be reused and should be discarded in hypochlorite solution or in a puncture-proof container. The used swab should be discarded in a yellow bag for biomedical waste disposal. During the process of donor selection, the medical officer examines the eligibility of the donor based on his entries in the questionnaire against the criteria for selection of donors. A detailed medical history and a short physical examination is done to ascertain the donor's medical fitness. Based on that, the donor is either accepted or deferred. In the event of a prospective donor being deferred, an entry is made in the donor deferral register and he or she is given adequate medical advice.
Any major surgeries performed or blood transfusion given to you? Just check your
If a person is found to be fit for donating blood, he is assigned a unique identifier number in the donor records. From here begins the process of blood collection. The prospective donor now goes to the blood collection area. The empty blood bags are stored at 22 to 24 degrees Celsius.
How will you visually inspect the bag chosen for blood collection?
Once the aluminium foil pack is opened, the blood bags inside should be utilized within 10 to 15 days or as per the manufacturer's instructions. For reasons of quality maintenance, the blood center should maintain a blood bag testing report. For NACO-supported blood banks, it can be obtained from NACO or SACS. The bags should be inspected thoroughly before being used for any particulate matter and turbidity in the anticoagulant solution or leakages from the sealed areas of the bag. The donor's unique ID number is pasted on every blood bag and test tube that will carry his blood sample. Once the blood bag is inspected and cleared for collection, the blood collection monitor at the donor's couch is set ready. It is important to calibrate and validate the monitor and other equipments before being put to use. The phlebotomy site is cleaned in a circular fashion using 3 cotton swabs of spirit, betadine, and spirit from the center towards the periphery in the presence of the medical officer. It is done in a single stroke of the needle. To maintain a closed system, the blood bag tubing is clamped and released only after the needle has been inserted in the vein. Ideally, the blood bag should be filled within 8 minutes. The donor should be continuously monitored to avoid any complications. In case of a hematoma, the second prick needs a new bag. But if over 100 ml of blood is already collected in the bag, then a second prick is not permitted.
How long can the donor be bled when component bags are used for collection? A. Less than 10 minutes. B. Up to 30 minutes. C. Up to 60 minutes. Yes, the correct answer is A. Less than 10 minutes.
When an adequate volume of blood is collected, the needle is taken out and pressure is applied to the phlebotomy site to stop the bleeding. Then it is bandaged with a medicated plaster. The blood bag is disconnected and taken for sample collection, stripping and sealing. It is important to observe biosafety norms by proper disposal of the used needle and attached tubings.
How do you dispose of phlebotomy needles? A. Dispose with general waste. B. Dispose in white or blue puncture-proof biohazard container with 1% sodium hypochlorite solution. C. Dispose in red biohazard container. Yes, the correct answer is B. Dispose in white or blue puncture-proof biohazard container with 1% sodium hypochlorite solution.
Blood bags intended for platelet separation are then stored at 22 degrees Celsius. Else, they should be stored at 4 degrees Celsius. The donor is monitored for another 5 minutes before being taken for refreshments. Before the donors are relieved, they are encouraged to give suggestions and feedback so that the quality of service can be constantly assessed and improved. It is estimated that approximately 1% of donors may suffer from vasovagal reaction.
How do you manage syncope in a blood donor? Are emergency drugs necessary in phlebotomy room? A. No. B. Yes. Yes, the correct answer is B. Yes.
As a necessary precautionary measure, an emergency kit within its expiry date, an oxygen cylinder along with its accessories, and trained staff must be prepared for any emergency. For the collection of a specifically desired blood component, a separate procedure called apheresis is undertaken using a dedicated apheresis machine. After the desired constituent of the blood is separated, the remainder is returned back to the donor's circulation. A similar blood collection procedure is followed for outdoor blood donation camps as well as blood mobile vans. For the bulk transport of blood from the collection site to the blood center or from blood center to the storage center, it is important to maintain the cold chain. Quality measures in donor area. Donor information and counseling is a must. Carry out medical history, including high-risk behavior, short physical examination, and hemoglobin estimation. Inspect blood bag for any defect in anticoagulant solution, discoloration, moisture on the surface of the bag and leakage. Use equipment that are cleaned, calibrated and checked for performance. Ensure proper donor arm cleansing. Ensure single prick phlebotomy with good flow of blood. Blood should be collected within
10 minutes.
for preparation of good quality components. Discard needles and lancets in puncture-proof containers. The hypochlorite solution must be prepared freshly every day. Take care of donors and get their feedback. Document to ensure traceability.
ABO blood grouping and RH typing procedure. Tube technique. ABO blood grouping is the primary investigation in blood transfusion service because of the risk it poses in ABO mismatched transfusions. Such transfusion reactions are due to the naturally occurring anti-A and anti-B antibodies in persons who lack the corresponding antigens on the surface of red blood cells. In transfusion practice, the next important blood group system after the ABO blood group system is the RH system. This is because of the high immunogenic potential of RH positive red cells when transfused to RH negative individuals. An individual is designated RH positive or RH negative depending upon the presence or absence of RHD antigen. This video describes how to perform ABO blood grouping and RH typing by conventional tube technique. Before starting the procedure, the following prerequisites need to be ensured. 3 ml of clotted sample of blood is required to perform the test. Check for proper labeling of the test sample with patient's name, registration number, age, sex, signature of phlebotomist, ward number. Verify and compare whether the details on the label of the test sample and the requisition form received match each other. Routine ABO grouping must include both cell and serum testing, as each test serves as a check on the other. What is the temperature at which the ABO blood grouping tests are done? A. 20 to 24 degrees centigrade. B. 30 to 35 degrees centigrade. C. 37 to 40 degrees centigrade. Yes, the correct answer is 20 to 24 degrees centigrade. Perform ABO grouping tests at room temperature or lower temperatures. Perform the test using freshly collected clotted sample, 3 to 5 ml. Do not use hemolyzed sample. All test tubes and microscope slides used should be clean and dry. Always add serum to the test tubes first before adding red cell suspension. The ratio of serum to cell is 2 to 1. Confirm all negative test reactions by examination under microscope. Check whether all the required equipment are calibrated according to the prescribed standards and all materials are available before the start of the procedure. Quality of reagents should be checked daily before the start of any test. The following equipment and materials are required for the procedure: test tubes, metallic or plastic racks, marker pens, tabletop centrifuge, microscope, normal saline, pasture pipettes with rubber teats, glass beakers, micropipette with tips, tissue paper rolls, 2 to 5% of cell suspension of the blood sample to be tested. Reagent cells, ABO cells, and antisera, anti-A, anti-B, anti-AB, anti-A1. Anti-D antisera, monoclonal IgM, and blend of IgM and IgG. Positive and negative controls, known RhD positive and RhD negative cells. Biohazard containers. Now moving over to the procedure, let's see step 1. Centrifuge the blood sample at the rate of 3000 rpm for 3 minutes to separate serum and cells. Make sure that the balance is maintained. Step 2. Preparation of 2 to 5% cell suspension. It is the basic requirement for all conventional tube tests. Transfer 2 drops of red cells to a labeled tube using pasture pipette with rubber teat. Fill approximately 3/4 of the test tube with 0.9% saline. Centrifuge at the rate of 2000 rpm for 2 minutes. Discard the supernatant fluid using pasture pipette. Repeat this washing process 3 times. Take 30 microliters of washed red cells from the red cell button and add 970 microliters of normal saline, which will give 1 milliliter of 3% cell suspension. This suspension will have a color mimicking tomato red. What does the routine ABO blood grouping by tube technique include? A. Cell or forward grouping. B. Serum or reverse grouping. C. Both. The correct answer is C. Both. Step 3. Now we will see the procedure for cell or forward grouping. Set up 3 rows of clean test tubes and label them anti-A, anti-B, anti-AB. Anti-AB testing is optional. Add 2 drops of reagent antisera anti-A, anti-B, anti-AB in the respective tubes. Add 1 drop of the prepared 2 to 5% cell suspension of test sample to each of the test tubes. After 5 to 10 minutes, centrifuge the test tubes at the rate of 1000 rpm for 1 minute. Observe for agglutination or hemolysis against a well-lit background. Record the results immediately. When the results are negative, confirm the results with a microscope. Next, we will see the procedure for serum or reverse grouping. Label 3 test tubes, A cells, B cells and O cells. Make a pool of 3 to 5 known donor cells of each group in the labeled test tubes. Wash 3 times with 0.9% normal saline and make 2 to 5% cell suspension for each group separately. This pooled cell suspension for A, B and O groups should be prepared daily. Label 3 test tubes, A cells, B cells and O cells. Add 2 drops of test sera in each tube. Add 1 drop of pooled A cell suspension to the tube labeled A cells. 1 drop of pooled B cell suspension to the tube labeled B cells and 1 drop of pooled O cell suspension to the tube labeled O cells. After 5 to 10 minutes, centrifuge the above test tubes at the rate of 1000 rpm for 1 minute. record the results immediately. Now, let us see how Rh typing is performed. What monoclonal antibody is used for Rh typing? A. IgM. B. IgM and IgG blend. C. Both. The correct answer is C. Both. For RhD typing, we use two reagent antisera, namely IgM D1 and blend of IgM and IgG D2. Label two test tubes D1 and D2. Add 2 drops of anti-D1 and anti-D2 in each of the labeled test tubes. Prepare 2 to 5% washed cell suspension of test sample as described previously. Add 1 drop of the 2 to 5% cell suspension in each of the labeled tubes. Centrifuge at the rate of 1000 rpm for 1 minute. Observe for agglutination or hemolysis against a well-lit background. Record the results immediately. When the results are negative, perform weak D testing with test tube D2. Step 6. When the RhD antigens are low in number over the red cell membrane, we perform weak D testing to detect the antigens. Now, let us see the procedure. Take 2 drops of anti-D, blend of IgG and IgM in a test tube labeled test or test tube D2 for Rh typing procedure, and in test tubes labeled positive control and negative control. Add 1 drop of 2 to 5% washed cell suspension of test sample in test tube labeled test or D2. Add 1 drop of 2 to 5% washed cell suspension of control D positive cells in test tube labeled positive control. Add 1 drop of 2 to 5% washed cell suspension of control D negative cells in test tube labeled negative control. Incubate for 20 to 30 minutes at 37 degrees centigrade. Wash the cells thrice with 0.9% normal saline. Decant the last supernatant and add 2 drops of polyspecific antiglobulin sera, AHG, to the cell button. Mix gently and centrifuge at a rate of 1000 rpm for 1 minute. Gently resuspend the cell button and look for agglutination. If there is no agglutination, add IgG sensitized O RBCs. All negative results must be confirmed under a microscope. What do you interpret when no agglutination is seen after adding IgG sensitized O red cells? A. Sample is Rh negative. B. Sample is Rh positive. C. Test is invalid. The correct answer is C. Test is invalid. Interpretation. How do you interpret the results? If there is agglutination in the test sample tube and positive control tube with a smooth suspension of cells in negative control, the donor is labeled weak D. If there is no agglutination in test sample tube and negative control tube with agglutination of cells in positive control tube, the sample is labeled Rh negative. If negative control tube shows agglutination, the results are invalid. If there is no agglutination after adding IgG sensitized O RBCs, the test is invalid. Importance of weak D. The corresponding donor blood unit should be labeled RHD positive. In this scenario, the individual should be considered RHD positive as a blood donor and RHD negative as a recipient. The grading of agglutination reaction is shown in this picture. The results of forward and reverse grouping combinations for various blood groups are shown in this table. ABO grouping and RH typing is the simplest test in blood transfusion service, but also the test where most clerical errors occur, with a potential for fatal outcomes in the recipient. Hence, prompt and proper recording of all test results are as important as proper test procedure. Cross-matching procedure. Cross-matching plays a vital role in the blood transfusion service. Is cross-matching essential before issuing blood? A. Yes. B. No. If yes, then why? According to NACO guidelines and DGHS standards, cross-matching is done to detect any clinically significant antibodies in the patient's serum against donor cells and also to ensure that particular unit of blood may be safely transfused to a patient. This video describes how to do a cross-matching procedure, compatibility testing. Before starting the procedure, the following prerequisites must be confirmed. 3 ml of freshly collected clotted sample and 3 ml of anticoagulated EDTA sample of the patients is required to perform the test. Check for proper labeling on the test sample with patient's name, registration number, age, sex, signature of phlebotomist, ward number. Verify and compare whether the details on the label of the test sample and the requisition form received match each other. What should we do if an incomplete requisition form is received for cross-matching? A. Call the hospital ward and fill details and keep the sample for cross-matching. B. Ask for a new, completely filled form and a fresh blood sample. The correct answer is B. In case of incomplete details, the requisition form should be returned to the hospital source for a new completed form and a fresh sample. Confirm the blood group and RH type of the received test sample. Do not accept hemolyzed samples. Kindly check whether all the equipment are calibrated according to the prescribed standards and all required materials are made available before the start of the procedure. Quality of reagents should be checked daily before the start of any test. The following equipment and materials are required: tabletop centrifuge, microscope, glass tubes, pasture pipettes, rubber teats, glass beakers, plastic or metal racks to hold the tubes, micropipettes with tips, biohazard containers, 2 to 5% suspension of washed donor cells and patient cells, recipient serum and donor plasma, normal saline, polyspecific anti-human globulin, anti-IgG plus anti-C3d, IgG sensitized O check cells. Now moving over to the procedure, let's see step 1. Centrifuge the patient's samples at a rate of 3000 rpm for 3 minutes to separate serum and the cells. Make sure that the balance is maintained. What are the types of cross-match available? A. Major cross-match. B. Minor cross-match. C. Both A and B. The correct answer, C. Both A and B. Prepare 2 to 5% cell suspension of donor red cells from the blood bag segment for major cross-match. Similarly, prepare 2 to 5% cell suspension of patient's red cells from anticoagulated sample for minor cross-match. Step 2. Now we will see how to prepare a 2 to 5% cell suspension. It is the basic requirement for all conventional tube tests. Arrange labeled test tubes in the test tube rack. Transfer 2 drops of red cells to labeled tube using pasture pipette with rubber teat. Fill approximately 3/4 of a test tube with 0.9% saline. Centrifuge at the rate of 2000 RPM for 2 minutes. Take out the test tube from the centrifuge without disturbing the cell button. Discard the supernatant fluid using pasture pipette. Mix well and resuspend the cell button. Repeat this process 3 times. Take 0.3 ml of washed red cells from the cell button and add 9.7 ml of normal saline, which will give 10 ml of 3% cell suspension. This suspension will have a color mimicking tomato red. What do we mean by major cross-match? Patient's serum cross-matched with donor red cells. Patient's red cells cross-matched with donor serum. The correct answer is A. Step 3. Now we are going to see the procedure for cross-match by saline technique to detect IgM antibody. Label 2 test tubes, major cross-match and minor cross-match. Remember to always add serum before the red cells. Add 2 drops of patient's serum or plasma for major cross-match in the cross-match labeled tubes. Add 2 drops of donor serum or plasma for minor cross-match in the cross-match labeled tubes. Add 1 drop of 2 to 5% cell suspension of donor red cells for major cross-match and 2 to 5% cell suspension of patient's red cells for minor cross-match to the above test tubes. Centrifuge at the rate of 1000 RPM for 1 minute. Examine for hemolysis or agglutination after gently resuspending the red cell button. Record and interpret the results immediately. Confirm the negative results with a microscope. Is minor cross-matching important when issuing blood? A. Yes. B. No. The correct answer is A. If donor's serum has not been screened for irregular antibodies, it is advisable to do minor cross-matching. Step 4. Now we are going to see the procedure for cross-matching by indirect anti-human globulin test, IAT, to detect IgG antibody in separate labeled test tubes. Add 2 drops of patient's serum in a labeled tube for major cross-match. Add 2 drops of donor serum in the labeled tube for minor cross-match. Add 1 drop of 2 to 5% red cell suspension of donor for major cross-match and 2 to 5% red cell suspension of patient for minor cross-match. Incubate the test tubes in a water bath at 37 degrees centigrade for 30 to 60 minutes. Centrifuge at the rate of 1000 RPM for 1 minute. Examine for agglutination or hemolysis after gently resuspending the red cell button. If there is no hemolysis or agglutination, wash the cells 3 times with normal saline and completely decant the last wash. Add 2 drops of polyspecific anti-human globulin AHG reagent to the dry cell button. Centrifuge at the rate of 1000 RPM for 1 minute to look for agglutination. Record and interpret the results immediately. Add 1 drop of IgG sensitized O cells to all the negative AHG results. Centrifuge at the rate of 1000 RPM for 1 minute and check for agglutination. Confirm the negative results with a microscope. Interpretation. How do we interpret the cross-matching results? If there is no agglutination in both of the cross-matched tubes, major or minor, then the donor unit is compatible with the recipient. If there is agglutination in any of the cross-matched tubes, major or minor, then the donor unit is incompatible with the recipient. If there is no agglutination after adding the IgG sensitized O cells, the test result is invalid and has to be repeated. How long should the cross-matched sample and donor unit segment be stored in the blood bank? 3 days after issue, 7 days after issue, 30 days after issue. The correct answer is B. Retain the tube segment of the cross-matched unit along with the unit number label and attach to patient's sample vial with an adhesive tape for a period of 7 days. Cross-matching, when done correctly, can prevent transfusion reactions and save a patient's life. Screening for transfusion transmissible infections. Screening for transfusion transmissible infections is critical in blood transfusion services to ensure patient safety. What are the infections that are mandatorily screened for on all blood units in India? In India, every blood unit collected from the donors has to be screened mandatorily for HIV 1 and 2, hepatitis B virus, hepatitis C virus, malaria and syphilis. This video describes the ELISA and rapid testing methods for HIV, HBV and HCV screening, smear tests for malaria screening, RPR test for syphilis screening, HIV, HBV and HCV screening. HIV, HBV and HCV are routinely screened by ELISA tests which detect anti-HIV antibodies, HBV surface antigen and anti-HCV antibodies. ELISA procedure. First, let us list out and describe the equipment, reagents and basic requisites required to perform the ELISA procedure. Equipment: ELISA washer, ELISA reader with printer, incubator, calibrated micropipettes 1 to 10 microliters, 5 to 40 microliters, 40 to 200 microliters, 200 to 1000 microliters, tabletop centrifuge. Consumables: kits for testing anti-HIV antibodies, HBV surface antigens and anti-HCV antibodies. Micropipette tips 20 to 200 microliters, 100 to 1000 microliters. Gloves, test tubes, test tube racks, 1% sodium hypochlorite solution, distal water, tissue paper, marker pen. It is important that biosafety precautions be taken before the test is performed. We now proceed to see how the ELISA test is performed. Preliminary measures. Sample identification is done by cross-verifying donated blood unit numbers with corresponding pilot tubes containing serum. Check the reagent kits for lot numbers, expiry date and any visible abnormal changes. Prepare worksheet with particulars such as name of the test, date of testing, reagent lot number and expiry date, name of the technician performing the test, signature of officer in charge, and unfilled columns for entering positive and negative controls, and donor unit numbers in sequence. Always adhere to manufacturer's instructions. Test kits, reagents and samples are brought to room temperature. The donor samples are centrifuged to separate the serum, 3000 rpm for 3 minutes. Test procedure. Prepare wash and buffer solutions according to the manufacturer's instructions. With the help of a micropipette, load the respective wells with the required volume of controls and serum samples with diluent. How do you hold the micropipette during sample loading? A. Horizontal with tips touching the side. B. Vertical with tips not touching the side. Yes, the answer is B. Vertical with tips not touching the sides. Hold the micropipette vertically and dispense the samples into the wells. Do not touch the sides of the well to avoid cross-contamination. Make sure that tips are changed after dispensing each and every sample. Discard the tips in a kidney tray containing 1% sodium hypochlorite solution. Then incubate the microplate at temperature and duration as instructed. Now wash the microplate using ELISA washer as per kit literature. Invert the plate over a tissue paper and dry it by gently tapping. Then add enzyme conjugate and incubate again. Repeat the washing step. Meanwhile, prepare the enzyme substrate and keep it ready. Dry the microplate and add enzyme substrate to the wells as per instructions. Add stop solution to fix the color developed in the wells. Ensure that the blank well is negative. If not, the test is invalid. Results must be read immediately using the ELISA reader. A printout showing the absorbance values for the samples in the microplate is obtained. Interpretation of results. Calculate the cutoff value as per the kit literature. Those which are above the cutoff value are interpreted as positive or reactive. What is the grey zone in the interpretation of OD values in the ELISA test? A. 10 to 20% above cutoff. B. 0 to 10% above cutoff. C. 0 to 10% below cutoff. D. 10 to 20% below cutoff. Yes, the correct answer is C. 0 to 10% below cutoff. Values ranging from 10% below the cutoff absorbance to that of the cutoff value fall under the grey zone. Values below the grey zone are interpreted as negative. Samples in the grey zone have to be retested, and if the cutoff value falls within the grey zone again, or if it is more than the cutoff value, then it is considered positive. Document the results. The printed report of absorbance values and the worksheet should be maintained in separate registers. How do you discard the biomedical waste generated? After the test is over, discard the tips and microplate in the red biohazard container. All the infected surfaces are cleaned with 1% sodium hypochlorite solution. If there are blood spills, clean them with 1% sodium hypochlorite solution. Unusual outcome of the ELISA test should prompt you to reassess the entire procedure step by step and make the necessary corrections. For example, if there is a high background color, check for accidental reuse of disposable tips, contamination in the reagents or wash buffer, improper washing or inappropriate incubation. Similarly, if there is no color development, check for the following. Have any steps been missed out or skipped, such as addition of sample conjugate, substrate incubation, or addition of reagents in the wrong sequence? An outdated microplate or reagent, or using a contaminated stopping solution. Likewise, if there are bad results in one column or row, check for clogging of wash channel in the washer, well-to-well contamination, improper washing. Always remember, even this third generation ELISA testing cannot detect the antibodies during the window period. Rapid diagnostic tests. When ELISA testing is not feasible during emergency situations, rapid diagnostic tests based on immunochromatography is done. In this procedure, when bands form in the control and test regions, it is considered positive. When a band forms only in the control region but not in the test region, it is considered negative. When no bands form in the control and test regions, then the test is invalid. This concludes the screening methods for HIV, hepatitis B and hepatitis C viruses. Malaria screening. The materials required for malaria screening are microscope, glass slides, Leishman's stain, Sorensen's phosphate buffer with pH of 6.8, cedarwood oil. Now let us move on to the screening procedure for malaria. It is done by the microscopic examination of thick and thin blood smears. Prepare at least 2 thick smears and 2 thin smears from the EDTA sample within 2 hours of collection. Stain only 1 set of smears and leave the duplicates fixed in methanol for restaining when in doubt. How do you prepare a thick smear? Place a drop of blood on the specimen slide. With the corner of a clean slide, make circular motions in the drop to a diameter of 1 to 2 centimeters. How do you prepare a thin film? Place a drop of blood on the specimen slide. Keep a clean spreader slide at a 45-degree angle towards the drop of blood and wait till the blood spreads along the entire width of the spreader slide. Now push it forward rapidly and smoothly. Keep it aside for air drying. How do you know that the prepared thick smear is adequate? A. You cannot look through the smear on the slide. B. You can read newsprint through the smear on the slide. Yes, the correct answer is B. You can read newsprint through the smear on the slide. You should be able to read newsprint through the thick smear on the slide. Air dry these smears for 30 minutes to 1 hour at room temperature. Now, both the smears are ready for staining. How do you stain the thin smear? The thin smear is stained by flooding the smear with Leishman's stain and leaving it for 2 minutes to fix. Now, add twice the amount of phosphate buffer. Leave to stain for 15 minutes. Wash off the stain with tap water. Dry the slide upright. The slide is now ready. How do you stain the thick smear? Thick smear is also stained similar to the thin smear. It is then kept in distilled water for 10 minutes and then dried. The primary staining procedure is once again repeated. Now the slide is ready for reading. How do you use thick and thin smears for Plasmodium detection? A. Thick smear for species identification. B. Thin smear for parasite detection. C. Thick smear for parasite detection and thin smear for species identification. Yes, the correct answer is C. Thick smear for parasite detection and thin smear for species identification. Thick smears are used for detection of malarial parasites and thin smears for identification of species. Ideally, thick smears are examined for a minimum of 200 oil immersion fields by using 100x objective. If there is evidence of malarial parasite in the thick smear, identify the species by examining the thin smear. Now, let us see some pictures of malarial parasites in the peripheral blood smear. Malarial parasite screening can also be done by rapid antigen detection, immunochromatography tests. How long can malarial parasites remain viable in stored blood components? A. 18 days. B. 3 days. C. 1 day. Yes, the correct answer is A. 18 days. Since asymptomatic carriers are known in endemic areas and malarial parasites can survive for at least 18 days in plasma and whole blood, screening for malaria is absolutely essential. Syphilis screening. We now move on to discuss the screening method for syphilis by rapid plasma reagent test. The materials required for this test are RPR cards, carbon-coated antigen, positive and negative control, small sticks, dropper, VDRL rotator. This test detects the anti-lipoidal antibodies which form black floccules when carbon-coated antigen is added. The procedure is as follows. First, bring the kit and reagents to room temperature. Mix the carbon-coated antigen suspension by gently agitating before testing. Place 50 microliters of patient's serum, positive and negative control, in the circles using sample dispensing pipette. Add 1 drop of carbon-coated antigen to the serum sample using antigen delivery dropper. Take care not to touch the liquid with the dropper tip. Mix using the stick. Then, rotate the card at 180 RPM for 8 minutes in the VDRL rotator. Examine the card for floccule formation to interpret the results. How do you interpret RPR test results as reactive? A. Black floccules against white background. B. No floccules in an even grey background. Yes, the correct answer is A. Black floccules against white background. If large or medium black floccules are seen against a white background, it is interpreted as reactive. If there are no floccules in an even grey background, it is interpreted as non-reactive. How long are the spirochetes viable in stored blood components? A. 18 days. B. 7 days. C. 3 days. Yes, the correct answer is C. 3 days. Since spirochetes can be viable up to 72 hours in citrated blood at 4 degrees centigrade, there is a risk of transmission of syphilis. This age-old RPR method is simple and holds good even in modern transfusion practice. Screening procedure for transfusion transmissible infections is very crucial. Hence, lab personnel should ensure quality throughout the entire screening procedure. Preparation of blood components. In the past, whole blood was the only preparation that could be administered to replace red cells, platelets, coagulation factors, in addition to what patients required. This caused unnecessary administration of unwanted cells or plasma constituents. Large volumes of whole blood were needed to achieve satisfactory replacement of a particular component. Significant advances in transfusion medicine have been made whereby separation of blood can be done in a closed system and patients can be administered specific replacement therapy. 1 unit of donor's blood can be utilized for preparation of different components and thus can benefit more than one patient. Always prepare 100% components wherever facilities are available. Constituent achievement of quality is the ultimate aim of component preparation. Hence, strict adherence to the standard operative procedure is imperative. This video describes component preparation by platelet-rich plasma method, the most widely used method in our country. For component preparation, you need a separate, well-lit, air-conditioned, dedicated room of at least 50 square meters with workbench and electrical installation facilities. This room should be kept hygienic with proper pest control measures. What should be the ambient temperature for component separation? A. 37 to 39 degrees centigrade. B. 20 to 25 degrees centigrade. C. 30 to 35 degrees centigrade. Yes, the correct answer is B. 20 to 25 degrees centigrade. Ambient temperature of the room should be maintained between 20 and 25 degrees centigrade. We need the following equipment to prepare and store blood components. Deep freezers, -30 to -40 degrees centigrade, -20 to -80 degrees centigrade. Blood bank refrigerator, 2 to 6 degrees centigrade. Platelet incubator with agitator maintained at +20 to +24 degrees centigrade. Refrigerated centrifuge. Laminar airflow. Weighing scale. Plasma expressor. Dielectric sealer. Stripper. Water bath 37 degrees centigrade. Cryoprecipitate bath 4 degrees centigrade. Dry rubber balancing material. Preliminary measures for component preparation. Ensure blood units are collected within 8 minutes. What is the maximum time limit for component separation from time of collection? A. 24 hours. B. 20 hours. C. 8 hours. Yes, the correct answer is C. 8 hours. If platelets have to be harvested, the blood bags should be kept at room temperature 20 to 24 degrees centigrade and should be separated within 6 to 8 hours from the time of collection. Refrigerated centrifuge is brought to the desired temperature and kept ready. Blood bags must be weighed and balanced equally in opposing cups. Separation of platelet-rich plasma from the whole blood by light spin. Program refrigerated centrifuge for light spin with appropriate speed and duration according to the manufacturer's instructions. The bag should be so placed that its broadside faces the outside wall of the cup. Close the lid and start the spin. Ensure that correct speed of centrifugation and time are maintained. When the spin is completed, gently remove the blood bags. Be careful not to disturb the separated layers of the components. Now, the primary bag is fixed carefully in the plasma expressor. Then, the hermetic seal is broken. Express approximately 3/4 of the plasma into the satellite bag and clamp the tubing. Make sure that adequate amount of plasma is present in the packed cells. Separate the primary bag with red cells and store in the blood bank refrigerator. If Adsol or SAG-M triple bag system is used, transfer all platelet-rich plasma into empty satellite bags and add additive solution to red cells. Seal the tubing of the bag with red cells and separate it from the satellite bags. In triple bags, transfer supernated plasma to platelet bag, which will be centrifuged later to separate plasma and platelets. One of the satellite bags containing platelet-rich plasma is processed further to prepare platelets. Separation of platelet concentrates and plasma from platelet-rich plasma by hard spin. Program the refrigerated centrifuge for hard spin as per manufacturer's instruction. Place platelet-rich plasma bag along with remaining satellite bags. Close the lid and start the spin. Similar steps followed in light spin will be repeated. Express approximately 200 milliliters of the supernatant platelet-poor plasma into another empty satellite bag. Seal the tubing of the bag with plasma and separate it from the satellite bag with platelet concentrate. When can the platelet concentrate bag be stored in platelet agitator? A. Immediately after component separation. B. After leaving it undisturbed for 1 hour. C. After storing in blood bank refrigerator for 1 day. Yes, the answer is B, after leaving it undisturbed for 1 hour. Ensure approximately 50 milliliters of plasma is left with platelets, which will be left undisturbed for 1 hour at room temperature. Then, at the end of 1 hour, the platelets are resuspended and stored at 20 to 24 degrees centigrade at constant agitation in a platelet incubator with agitator for a maximum period of 5 days. Make sure that the unlabeled surface of the platelet concentrate bags are facing up to facilitate better oxygen diffusion. Store the bag with plasma at -30 degrees centigrade or below in the deep freezer. What is the shelf life of fresh frozen plasma? A. 1 month at -30 degrees centigrade. B. 1 year at -30 degrees centigrade. C. 10 years at -30 degrees centigrade. Yes, the answer is B, 1 year at -30 degrees centigrade. Most labile coagulation factors are preserved for 1 year if fresh frozen plasma is kept at -30 degrees centigrade or below. Preparation of cryoprecipitate from fresh frozen plasma. Remove fresh frozen plasma bag from the deep freezer. Place it inside the plastic wrapper. Suspend the bag with wrapper at 4 degrees centigrade in a circulating water bath. Within 15 to 30 minutes, the plasma becomes slushy. Centrifuge the bag with plasma at 4 degrees centigrade with speed and duration as per manufacturer's instruction. Supernatant cryopoor plasma is siphoned out, seal the tubing and separate the bags. Cryoprecipitate is stored at -30 degrees centigrade or below in the deep freezer for a period of 1 year. Things to remember. Ensure all the equipments are regularly calibrated. Ensure quality control for 1% of all components prepared. Efficacy of the prepared components is reassured by the following quality parameters. The primary goal of component therapy is to ensure quality with right components to the right patient in the right quantity at the right time. Separate components. Ensure quality.
Normal, healthy cells are programmed to die and be replaced by new ones. But cancer cells, shown here in brown, don't die. They live on, dividing and dividing, crowding out the healthy cells and spreading, often through the bloodstream and the lymph system to other organs. Blood. 10 pints of life force, coursing through thousands of miles of arteries, veins, and capillaries. Those blood vessels carry blood to every other organ, keeping them functioning and thriving. Our red blood cells carry oxygen and nutrients. Our platelets stop bleeding and help to heal our wounds. Our white cells protect us against infection. And the yellow liquid plasma in which they are suspended carries an array of proteins that regulate bleeding and clotting. In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain. When blood vessels are injured, proteins called clotting factors help the platelets stick together to plug cuts and breaks at the site of the injury and stop the bleeding. Without clotting factors, normal blood clotting can't take place. The result? Profuse bleeding. Our red blood cells make up 40% of our blood's volume. They're made continuously in the bone marrow, looking like flattened donuts without the holes. Red blood cells contain hemoglobin, a bright red protein which gives blood its color. When we breathe, as our blood passes through our lungs, oxygen molecules attach to the hemoglobin. Then the red blood cells and hemoglobin transport the oxygen throughout the body and release it to all our cells and tissues. When the hemoglobin molecules are emptied, they attract carbon dioxide and other waste gases, which they take back to the lungs to be exhaled. Anemia occurs when there are too few red blood cells or not enough hemoglobin. Exhaustion is the common sign of anemia. In people with sickle cell disease, their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme pain.
Thank you. We already exceeded the time. Yeah, if there are any queries, then generally, when whole bed is taken, when it is not used, whole components are not used, they are used for other donors as required and other recipients as required. So they are being stored, and whenever there is a to extract the components, they are being extracted and used for various requirements. Hope I have answered you. And it is mandatory for also every blood bank to do all these procedures. So we have to ensure while we are donating also to ensure the safety facility that all these are being connected and blood bank. And also when we collect the blood, we need to ensure that we are checking that all these tests are confirmed or not. Having the safety precautions can ensure that the donors and the recipients both are beneficial. So thank you. If you have any further queries, you can take the other one. There is a feedback loop. Therefore, the feedback form.
Before we study about blood disorders, we must know the composition of blood in a healthy individual. Blood is a body fluid in humans and other animals that delivers necessary substances such as nutrients and oxygen to the cells. In vertebrates, it is composed of blood cells suspended in blood plasma. The blood cells are mainly red blood cells, also called RBCs or erythrocytes, white blood cells, also called WBCs or leukocytes, and platelets. Plasma, which constitutes 55% of blood fluid, is mostly water, 92% by volume, and contains dissipated proteins, glucose, mineral ions, hormones, and carbon dioxide. All the blood cells families work together and maintain your body so that you are healthy and strong. Red blood cells transport oxygen to your body's organs and tissues. White blood cells help your body fight infections. Platelets are tiny molecules that stick up together and build a clot on bleeding wounds. All three cell types form in the bone marrow, which is the soft tissue inside your bones. Your body needs millions of blood cells produced by bone marrow to carry out vital functions. But sometimes bone marrow cannot work properly due to certain factors and results in blood cell disorders. A blood cell disorder is a condition in which there's a problem with your red blood cells, white blood cells, or the smaller circulating cells called platelets. Blood cell disorders impair the formation and function of one or more of these types of blood cells. Thalassemia is a group of inherited blood disorders. These disorders are caused by genetic mutations that prevent the normal production of hemoglobin. Hemoglobin is the carrier molecule which carries the oxygen obtained during the process of respiration. When red blood cells do not have enough hemoglobin, oxygen doesn't get to all parts of the body. Organs then do not function properly. These disorders can result in bone deformities, enlarged spleen, heart problems, growth and developmental delays in children. People who suffer from thalassemia need to undergo regular blood transfusions to maintain healthy RBCs and hemoglobin levels in the body. Leukemia. Leukemia is blood cancer in which malignant white blood cells multiply inside your body's bone marrow. Usually, leukemia involves the production of abnormal white blood cells, the cells responsible for fighting infection. However, the abnormal cells in leukemia do not function in the same way as normal white blood cells. The leukemia cells continue to grow and divide, eventually crowding out the normal blood cells. The end result is that it becomes difficult for the body to fight infections, control bleeding, and transport oxygen. What causes leukemia? Is leukemia hereditary? The exact cause of leukemia is not known, but it is thought to involve a combination of genetic and environmental factors. Leukemia cells have acquired mutations in their DNA that cause them to grow abnormally and lose functions of typical white blood cells. It is not clear what causes these mutations to occur. One type of change in the cell's DNA that is common in leukemia is known as chromosome translocation. In this process, a portion of one chromosome breaks off and attaches to a different chromosome. Most cases of leukemia are not believed to be hereditary, but certain genetic mutations and conditions can be passed along to offspring that increase the chances of developing leukemia. Treatments. Treatment for your leukemia depends on many factors. Your doctor determines your leukemia treatment based on your age and overall health, the type of leukemia you have, and whether it has spread to other parts of your body, including the central nervous system. Common treatments used to fight leukemia include stem cell transplant, chemotherapy, and radiation therapy.
Blood groups and blood transfusion disorders of blood. What is blood? There are various definitions which defines blood. In simple words, it's a red liquid which circulates in arteries and veins, humans and other vertebrate animals, carrying oxygen to and carbon dioxide from the tissues of the body. Other defines blood as vital principle of life. It is the mechanism of blood in bodies of living organisms which can differentiate one individual from the other based on the presence or absence of specific antigens in blood. This system is called blood group. There are 4 blood groups: A, B, AB, and O blood groups. While blood types are 100% genetically inherited, the environment can potentially determine which blood types in a population will be passed on more frequently to the next generation. Blood type A, if the red blood cell has only A molecules on it. Blood type B, if the red blood cell has only B molecules on it. Blood type AB, if the red blood cell has a mixture of both A and B molecules. Blood type O, if the red blood cell has neither A or B molecule. Blood group facts. There are 8 different common blood types, which are determined by the presence or absence of certain antigens, which are substances that can trigger an immune response if they are foreign to the human body. Since some antigens can trigger a patient's immune system to attack the transfused blood, safe blood transfusions depend on careful blood typing and cross-matching. Now, the next turn is to know about an interesting factor known as Rh factor, which can be either present positive or absent negative. In general, Rh negative blood is given to Rh negative patients, and Rh positive blood or Rh negative blood may be given to Rh positive patients. Are you a universal donor? A universal recipient? The universal red cell donor has type O negative blood type. The universal plasma donor has type AB positive blood type. Blood transfusion. Blood transfusion is a medical term. It means a procedure used to transfer blood, or some products based on blood, from the circulatory system of one human to that of another human. Blood types are very important when a blood transfusion is necessary. In a blood transfusion, a patient must receive a blood type compatible with his or her own blood type. If the blood types are not compatible, red blood cells will clump together, making clots that can block blood vessels, causing a potentially fatal situation. Therefore, it is important that blood types can be matched before blood transfusions take place. In an emergency, type O blood can be given because it is most likely to be accepted by all blood types. However, there is still a risk involved. Why blood transfusions are performed? Loss of blood during surgery or from an injury or an illness. An inability to make enough blood. Some illnesses and treatments can harm the bone marrow's ability to make blood. E.g., chemotherapy decreases production of new blood cells. To prevent complications from an existing blood or bleeding disorder, such as sickle cell disease, thalassemia, or anemia caused by kidney disease, haemophilia, or von Willebrand disease. Preparing for a blood donation. If your child needs a blood transfusion, the doctor will speak to you about the procedure. If you have questions, be sure to ask. When you feel comfortable with the information and your questions have been fully answered, you'll be asked to sign an informed consent form. This form states that you understand the procedure and its risks, and you give permission for your child to have the blood transfusion. If the situation is not a life-threatening emergency, 2 tests will be done before the transfusion: blood typing and cross-matching. Common myths about blood donation. I can't donate because I have low iron. Your red blood cell count doesn't stay low forever. Come in and see if it has improved. Iron-rich foods help promote blood production. Citrus fruits help your body absorb iron. Dark, leafy green vegetables are a good source of iron. Lean red meat, as well as salmon and tuna, are good sources of iron. I can't donate because I'm diabetic. Diabetics may donate blood, even if they take medication. Oral medication is acceptable. Insulin-dependent diabetics may donate, provided they have not used beef source insulin since the 1st of January 1980. I can't donate because I have high blood pressure. As long as your blood pressure is below 180 systolic and 100 diastolic, you may donate. Medications taken for high blood pressure do not disqualify you from donating. I can't donate because I take medication. Most medication will not disqualify you as a blood donor. You may donate if you take aspirin, birth control pills, or high blood pressure medications. You may donate 24 hours following your last dose of antibiotics and are symptom-free. We can provide a complete listing of medication deferrals upon request. I can't donate because I have high cholesterol. A high cholesterol number does not disqualify you from donating, even if medication is used to control it. I can't donate because I have a tattoo. Donors who have a tattoo or permanent makeup may donate if it was performed by a licensed tattoo artist in Ohio, Kentucky, or Indiana. A complete listing of acceptable states can be provided upon request. The tattoo site must be clean, dry, and pain-free, or the donor is deferred until the site is healed. If the tattoo or permanent makeup was not applied by a licensed artist, donors are deferred for 12 months from the date of the application.